As healthcare continues to dramatically change, practices have had to rethink how patients are scheduled to make sure that providers are the right kind of busy. Today, we'll explore the patient scheduling landscape and how an analysis called optimization readiness can help elevate healthcare organizations. The need for an intelligent scheduler solution at the front of your revenue cycle is critical to maximizing efficiency while minimizing the downstream financial impacts posed by labor shortages and surging patient demand. The rise of AI has helped practices be more flexible and ensure that time slots are available for patients who need care the most. AI has also made it intuitive enough for newly onboarded staff to schedule patients that meet the goals of your practice. How can practices see how they can improve their scheduling? Optimization Readiness is an analysis that helps organizations see how they can automate and improve scheduling with AI and understand potential revenue. Practices can easily identify scheduling gaps, develop a plan, and then operationalize the plan to address these inefficiencies that can lead to gaps in care and have a negative impact to your bottom line. Optimization Readiness contains 40 key metrics that examine how scheduling impacts your practice. Every analysis starts with 12 to 24 months of your practice's data. Think of the data as starting from the second that the patient requests the appointment. We then slice that data in several ways to examine how scheduling and cancellations impact your patients, resources, referrals, and revenue. We'll also identify actual demand of when the patients schedule appointments and how to better align those with your provider's schedule templates. In this video, we'll preview an abbreviated version of the full analysis with some examples. The first analysis shows how far in advance our patients are scheduling an appointment. This graph looks at the practice as a whole and shows that 4.4% of the appointments are scheduled the same day, and 4.8% of the appointments are scheduled the day before. Taking a more granular look, we can see that on average, new patient appointments wait an average of 15 days to receive care. In initial discussions with the practice, they were certain that new patients were receiving appointments the same day or next day. While some new patients can schedule appointments that are the same day or next day for new visits, on average, those new patient appointments are waiting 15 days. This can be impactful to a practice, because if a patient must wait too long for care, they may choose to receive it elsewhere. Optimization Readiness takes this data and chooses how to optimize visits based on your practice's goals. An important goal is to make sure that the patients who need care the most receive priority appointments. Another analysis explores how far in advance appointments typically change. Change is defined as a cancellation or reschedule, and of course, a no-show. A rescheduled appointment can be as bad as a no-show, especially if it happens at the last minute. Sometimes there's no demand to backfill that opening on short notice. In this example, we can see that 37% of the appointments changed the day of or the day before. That's significant. With this information, we further investigate the reasons for these changes. In addition, we'll evaluate what time of day we're seeing these types of trends. The report will give this information to you at a practice level, based on the per-provider holds they schedule. In this example, we can see that the 9 to 10 o'clock time is the time when most patients change their appointments. Using this information, we might choose to make different decisions about how appointments are scheduled. Now let's take it to the next level by blending appointment data with billing data. Let's take a look at the CPTs that were used most often. And then, what was the variant between what was the lowest reimbursing insurance carrier to the highest? In this example, an arthrocentesis was performed 3,300 times with a variant of reimbursement from $183 to $807. This practice also performed a shoulder scope 154 times, and that ranging reimbursement was between $1,200 and $4,300. Why does this matter? It matters because, remember, this is the same practice whose new patients were waiting 15 days on average to receive an appointment. If we prioritize patients who need care the most, your practice has a higher likelihood of surgical conversion, allowing you to utilize ancillaries to perform at the highest end of reimbursement. Think about the incremental revenue that your practice can make just by identifying the goals of the practice and providing that information at the point of scheduling. The same data is used to compare physicians' performance against one another. This metric looks at a 5-minute scheduled block. What was the actual allowed? And how is the provider paid for the block of time? How does their performance compare to their peers? In this example, one of the providers received $1.3 million in actual allowed, and they worked 28,000 blocks of time. Their peer received an actual allowed of 1.4 million, but worked 1,000 fewer blocks of time. By using the optimization readiness analysis with predictive scheduling, we can take this classic bell curve and move providers over the median level of efficiency by prioritizing patients who need care the most. There's an art to the uniqueness of provider schedules. In this metric, we're looking at per provider per day of the week and how many of each appointment type were scheduled. The analysis uses the specific appointment types your practice uses to build the analysis. How many new? How many established? How many injections? How can we use this data to make a difference? Let's compare the actual appointment demand to the templates that are in place. If the data tells us that the provider has never seen more than 5 new patients in a day, and they have 10 new patient appointment slots on their template, it is likely that some of those new patient slots are being used to see established patients. With this information, we can drive template changes based on true data elements rather than assumptions. Finally, we can use this data to show what the incremental revenue increase might look like for your practice based on your data. For example, what happens if this organization prioritizes care for patients who need it the most and bring their providers to the median level of efficiency? The data will uncover a significant opportunity for incremental revenue, making sure that all patients have appointments while meeting the goals of your organization. Scheduling is difficult, and optimization readiness from Readiness can shine a light on scheduling opportunities. Contact us today to see how optimization readiness can help your organization improve patient access and care.